I'm here with Dr. Harry Adelson, one of my favorite people on the planet. Now listen, this man has changed and saved my life. You really have. You know, it was a year ago, and that's why we're doing this, because all of you, I did a Cellular Healing TV, which is in the link below if you actually want to watch my procedure and my injections. And many of you have asked, how is your low back, right? Because that was really the worst thing. My disc was terrible. I mean, desiccated, black, it wasn't looking very good at all. And it was to the point where, as you all know, I wasn't able to ski anymore. And it started to affect me not being able to bike anymore. Mm-hmm. So that's when I said, I'm not getting surgery, I'm getting stem cells. That was a year ago.
That's right.
Yeah, dude, my life's changed in a year. I mean, I can, do many things, right? It's like, and I have to say, it's evolved to where it's gotten better over a year. Is that typical?
Well, as much of an extraordinary person as you are, your low back pain was actually very typical. Yeah. You had this dehydrated, desiccated disc. Exactly. And there's really no good conventional treatment for a dehydrated disc other than fusion. And fusion is a terrible option.
Wasn't doing
so, what a desiccated disc, when you look at it on MRI, the discs look white, black. There's just no hydration in there. And a desiccated disc is a very painful disc. Yeah. And there's really nothing to do for it. Chiropractic doesn't really work that well for it. I mean, there's to get hydration back into that disc, the only thing that I'm aware of is stem cell therapy. Yeah. We take stem cells from your bone marrow, combine it with stem cells from your fat, and inject them directly into the disc. Yeah. It takes months to work, but when it kicks in, it lasts years, and it's probably my favorite thing to treat because it works so well, coupled with the fact that there's really no good other option for it.
Yeah, there wasn't for me. I mean, being a chiropractor, by trade, I did everything, except surgery, which to me wasn't an option. Admittedly, I got a second treatment about 6 months in. Mm-hmm. However, when you went in, we did the C-arm that's actually right behind us. You can maybe explain that a little more. But when you went in, it wasn't black. So the first treatment, actually, it looked very different. The first thing you said is, Dan, wow, it looks completely different. And you took little snapshots, and I have them. I should have brought them, but it looked completely different.
Well, it's not so much because the black or white that you only see that on MRI. It has to do with when you inject the contrast, how the disc accepts the contrast.
That's
when
what
it's
you said.
Really dry.
Yeah.
Because
you said it just went, whoa, it went right in. Right. That's it. Yeah.
But when it's a healthier disc, it sort of just the dye just stays in one place, and you can tell there's a better consistency to the disc.
I was awake the second time. I'm sorry. So that's when you said that. You're right. You said, wow, it went right in, Dad. It's so much better. But I did it a second time because that's who I am.
Mm-hmm. He wasn't patient to wait the full year.
Well, you know what? I mean, honestly, I think it was a lot of the ligaments around it were actually the problem.
And sometimes we do a follow-up touch-up, and that's fine.
It was worth doing. But, the extraordinary thing is that, I'm able to do things now that I wasn't able to do. And I didn't realize, actually, how much it was limiting me. So it's like you'd sit on the couch at night and I'd be realizing that I'd be like moving around, sliding down. That doesn't happen anymore. I just sit on my couch. So it's like those little things that become normal in your life. It's actually, they're not normal at all. It's like that was happening to me. But, I'd have to say is you did some, and when you watch the procedure here, like I said, you can watch the Cell TV in its entirety. You put me out the first time. I mean, and you did more than just my low back, but I woke up and I'm like, that's it. Mm-hmm. And here's the question I always get is, how long is the downtime? I was working the next day. I wasn't working out. I took a week off working out, and then I went back after a week. I was doing light things. I wasn't doing squats or anything stupid. But really, I mean, I'm telling you, I really didn't have, and this is my experience, I didn't have any downtime.
That's great. That's great. Well, like you said, we use an anesthesiologist to put people to sleep because it's very uncomfortable. It's a lipoaspiration. It's a bone marrow aspiration. That's where we get the stem cells, followed by an injection into your most painful area, which is your disc, and then we do a bunch of other injections. We do a stem cell epidural to put stem cells in the interface between your disc and your spinal cord, then all the ligaments of your low back. So you go to sleep, you wake up 2 hours later, and we're done.
Yeah.
Most people don't have a lot of, they have some post-injection soreness, but not terrible. Occasionally people are pretty sore for a couple of days. Yeah. But then we just ask people to take it very easy for 1 week, reasonably easy for a second week, and then 2 months of no getting injured. And that was tough with you. Like, no
Yeah.
mountain bike. Just don't get hurt. Don't fall off your mountain bike. Don't fall off your, don't go skiing. Let's take 2 months of just taking it very easy.
Our friend Ben Greenfield, he stayed with me. He came here and he got injected. And I have to, this is funny, but it's not funny. You said don't get hurt. He literally got up in the middle of the night to get water and sprained his ankle that you injected. I was like, it's okay in the long run, but don't get hurt. He's fine. Yeah. This is the C-arm that you referenced. And, one of the best parts about you, and we all swear by you, Dave Asprey, myself, Ben, I mean, a lot of people who we know that you have injected, I call him the Michael Jordan with the needle, man. You got to know where to hit the spot. But this helps. The C-arm gives you're watching that screen behind me. As you're going in, you're going exactly where you need to go.
Yeah, it takes all the guesswork out. There's 100% accuracy. So it's 100% accuracy of the needle, and then you inject a little contrast, which is an iodine solution that shows up black. And what that does is you see the flow pattern. So not only does that give you information about the morphology of your disc, the actual structure of your disc, but it also verifies that you're exactly in a joint if you're injecting into a joint and not in a fat pad or a blood vessel or something like that. So it eliminates all the guesswork, gives you 100% accuracy. Because if you're going to go through the time and emotional and financial investment of having your stem cells harvested, you want to be absolutely certain they are put exactly where you want them to
You
go.
did something else unique. Okay, you took my stem cells, which I wanted to make sure were completely viable, good stem cells, but you added exosomes to it. And I don't know if you do that for everyone.
We do it for most people.
Okay, most people. Which exosomes, if stem cells are the future of medicine, which I think they are, exosomes is the future of stem cells. So you do both just in case. Maybe you don't have as many viable stem cells, but it's not only just in case. When I look at the literature on exosomes, I do think it's the future of stem cells. So.
Yeah, because our own stem cells, what makes my stem cells, 50-year-old stem cells, is as we age.
That's what I was worried about.
Yeah, as we age, the number of vesicles filled with growth factors that are called exosomes reduce. And those are actually the active ingredient. Those are the ingredient that are responsible for communicating with the stem cells in the microenvironment that you're trying to treat. So what the lab that we use is they take placental stem cells, which are these very young, robust stem cells. They force them to manufacture and excrete these vesicles filled with growth factors that are called exosomes. They then separate the stem cell from the exosome, so you're discarding the other person's genetic material and DNA. You just have the substance that your own stem cells are lacking. We then add them to your own stem cells, in a sense turbocharging them, and we think that your own stem cells absorb them into themselves, thereby functionally making them a younger person's stem cell.
That's cool. Look, I know many of you, because I get the emails, were waiting to see how I did after a year before you pulled the trigger. And look, admittedly, it's not for everyone. I'm saying you offer to look at either their MRIs or even talk to them about their case to see if this is an option for them. So
just have a look at our website, DocereClinics.com.
Well, we're going to put a link here for them to get,
Sure.
So.
Have a look over. Make sure we resonate with you, because we're not for everybody. And then reach out to us, and what we'll do is we'll have you fill out a few short forms that we've created, and have you, if you have imaging such as an MRI, send them to us. Perfect. And at no charge we will look over it, and we will have a very good idea whether or not you're even a good candidate.
There you go.
Because if you're better off talking to a surgeon, believe me, the last thing I want to do is waste your time. So we will let you know if you're a better surgical candidate or if you are indeed a candidate.
Well, and you did that. A friend of mine, you said, look, for this particular thing, you need surgery. And my CEO, you were on the phone with him yesterday, and you said, well, because you asked him a few questions, and you said, okay, that I can help.
Right.
Yeah, so he'll tell you if he can help you or not, and thank you for doing that for them. So look for the link here, and it'll link you right to this guy. So, hey man, thank you.
So happy for you.
A year later, changed my life. There you go.